gas हो गया है, and they give you ajwain or some antacid, and they delay the treatment. So I want to tell you first about heart attack. What happens in the heart when the heart attack occurs? During heart attack, certain parts of the muscle of the heart, the blood supply is stopped to them. Certain parts, not all, by a blocked artery, which can be by a plaque or a blood clot. So what happens? The blood is not receiving full circulation. So the patient starts feeling a chest pain in the left side of the chest, like a squeezy pain, or some people are not sure, they say I'm just feeling discomfort, nausea, vomiting, sweating, and difficulty in breathing, and the pain can radiate to, it's very important, it can radiate to neck, jaw, back, and even stomach. So please do not confuse it with the acid or with a cervical pain or anything like that. So what should you do when you realize that this is a heart attack? I have told you the symptoms. So what you should do, you should put the patient in a sitting position, semi-reclined. If the patient is wearing tight clothes, loosen the clothes. Do not give him any painkillers except aspirin. If you are not allergic to it, then immediately give aspirin 300 to 325 milligram, chewable or oral, and don't allow the patient to eat anything or talk. First thing is to call emergency, and then give aspirin. And if you have a sublingual, that is under the tongue, trinitrate tablet with you, you can put that under the tongue and wait for the emergency or transport the patient immediately to the nearest hospital. This is what is about heart attack. Now, what is heart arrest or cardiac arrest? It's very different from heart attack. In heart attack, the heart is stopping the blood flow. The arteries are stopping the blood flow. But in cardiac arrest, it's an electrical failure of the rhythm of the heart. The cause may be, first cause is heart attack, left untreated can lead to cardiac arrest. Number 2 comes arrhythmias, that is a disturbed heart rhythm, which can be congenital or developmental. It can happen at any time. So arrhythmias are like, you must have heard ventricular fibrillation, supraventricular, these are all medical terms. So what I would say is disturbed heart rhythm. Third is cardiac myopathies. You must have heard that post-COVID, many people had heart issues. So what happened was cardiac myopathies thickened and hard heart and enlarged heart. So that can also lead to cardiac arrest. Then we come to, there may be an electric shock, and there will be electrolyte imbalance like magnesium or potassium disturbance that can lead, or severe blood loss, septic shock, certain medications, and severe trauma, lack of oxygen can lead to cardiac arrest. So what is the difference? The patient has collapses. While in heart attack, the patient is alive, speaking, asking for help, breathing, has a pulse. While in cardiac arrest, the patient is collapsed. He is either not breathing or he is having gasping breathing. He has almost no pulse or feeble pulse. So this is the main, he is not responsive. You call him and say, hello, what's your name? He will not respond. While a heart attack patient is alive and you can save him. Now in this, the treatment is totally different. You will, as soon as you see a patient having cardiac arrest, you start giving CPR. I think most of the people are these days trained. And give mouth-to-mouth breathing and start giving CPR till you get emergency help. So first thing is to call emergency help. Second is to start doing CPR and mouth-to-mouth breathing and wait, continue the CPR till help arrives. After that, the medical team will take over and they will do the fibrillator work in the ambulance itself. So now I hope that you understand the difference between heart attack and cardiac arrest. So these two should not be confused, and nobody should say that any discomfort is acid reflux. And another thing I want to say that ladies, women are not having as many warning signs as men. Men will get all the warning signs, but women will just have a silent heart attack. Even at rest, they will have breathing problems and chest pain, and they immediately go into. So we have to be, as females, we have to be more careful. And also diabetics can have silent heart attacks. So you need to be very careful. And what happens when you are alone? If there is nobody around you, what will you do? Are you going to panic? First thing is, call 112, emergency ambulance, keep the phone on speaker and say, I am alone, I think I am having a heart attack, I need help. Then you call your near and dear ones who is next to you and ask for help. Do not panic, sit in a semi-reclined position and immediately go to the hospital